Now turning on to today's presentation, I would like to welcome Allison Curry, a senior scientist and director of epidemiology and biostatistics research and prevention at the Children's Hospital in Philadelphia. Allison is going to give us a presentation on the New Jersey Safety and Health Outcomes Data Warehouse.
Thank you so much for having me. I've been at CHOP now for 17 years. I'm an epidemiologist, and I've been at the Center for Injury Research and Prevention. And the majority of my time at CHOP, I've been doing traffic safety research. I'm also a native of Bayonne, New Jersey. So it's good to see you all. I'm not sure how many of you have heard about the work that we're doing. So I'm going to kind of, in 10 to 15 minutes, try to just highlight kind of what we've been doing for the last 13 years, our new data dashboard, and then kind of encourage you to go check it out. Let us know let us know how good what you're seeing is, what you need, further ways we can collaborate. So if you go to njshow.chop.edu, this is our center. We actually have been doing this work in Jersey for 13 years, but we just recently made a center and a supporting website. And our goal really is to reimagine how data are collected, traffic safety data in particular, are collected, integrated, analyzed, and shared to support safe transport in New Jersey. So this is now available. I'll go through it a little bit and the data dashboard itself. But we've been doing work now to build a data warehouse with traffic safety and other relevant data across the state for the last 13 years. And if you look at this figure here on the right, kind of starting at the bottom, I'm just going to go over really quickly all the data sets that are integrated into the data warehouse. Moving from here, can you see my pointer? Or is it just me there?
Yes.
Yeah.
Oh, okay. So we have the entire motor vehicle crash data from the state, and these are all back to 2004. So we have 2004 through some of these data sets are through 2021, but we get most of them on an annual basis from our partners across the state. So we have motor vehicle crash records, all of the traffic citation data, and this is adjudicated traffic citation data that's already populated through the driver licensing file. We have all of the driver licensing data across the state. EMS, which is maintained by the Department of Health, trauma registry and hospital discharge data. And this is hospital discharge data, both in coordination with a crash, but also hospital discharges, ED visits, outpatient and inpatient visits more generally. So this and having the CHOP electronic health record is really helpful in us looking at risks, crash risks, adverse driving outcomes among people with medical conditions. We also have the birth and death data in New Jersey, and I'll go into this a little bit more, but we also have connected a ton of community indicators. And this is the data that I think may be helpful for you all as you're kind of thinking about how to improve traffic safety in your own communities. We currently have data, like I said, through 2021, although the linkage process does take a while. So to integrate all these data is a very laborious process. So we are a few years kind of behind, the current 2024 years. But we are constantly working to add new years to our data warehouse. We have 125 million records on 24 million individuals. So the interesting thing about these data are you only have to be in one of these data sets to be in the NJ Show warehouse. So if you think about a child who may be on a bicycle and goes to the hospital, they may not be in the motor vehicle crash data, but we have them because they'll be in the hospital discharge data. So this allows us to really look at vulnerable road users in a way that you can't do just with crash data alone. It also follows individuals over time. So when we're thinking about locating high-risk groups who have multiple traffic citations or multiple crashes, we can do that. And then it also looks, like I said, longitudinally over time from 2004 to 2021. Most of our, because we're at an academic center, most of our work up until the last few years have really been doing research in teen driving safety, older driver safety, pedestrians, driving safety among people with medical conditions. And so I'll make sure you have these slides afterwards, but if you go to njshow.chop.edu, you'll be able to find all 50 kind of abstracts and description of all 50 of our research studies across the state. But one of the things, as many of us on the team are public health professionals by nature, and so one of the things that we've been really working on in the last few years is putting, this amazing integrated data that we have across New Jersey into the hands of safety professionals. We know many of you rely on data for your day-to-day work, to know where to implement new countermeasures, but often you're reliant on raw data that may come from the Department of Transportation and isn't integrated with hospital and licensing data and all these other data sets, which could tell us really important information about who's getting in these events. And of course, if you even think about the 2020 Strategic Highway Safety Plan in New Jersey, core feature of many metrics in the SHSP. However, when we did research, we found that the New Jersey crash report misses 1/3 of all crash injuries. So this 63% are injuries that we can see on the crash report. This 37% you can only see in hospital data. So it's either not, that they don't use the checkbox, or these injuries are people are getting injured once they leave the scene. And if we think about bicyclists and pedestrians, 60% of all bicyclists who were injured cannot be found on the crash report. We're not seen as injured on the crash report. So this really does speak to the need to integrate these different data sources to kind of give us a complete picture of traffic safety across the state. And many of the recent safety strategies, so Vision Zero, Safe Systems Approach, and the National Roadway Safety Strategy, all really focus on distributing countermeasures equitably so that we can make sure that traffic safety solutions are prioritized in the communities that will benefit from the most. And I'm sure that you all think about this in your day-to-day work when you think, where do I put certain interventions, what communities need them, where are we going to be able to get the most bang for our buck in setting up these countermeasures and interventions. So what we're really trying to do is help inform this process. And there are certain features that are in the NJ show that really allow us to help you all in this process. One is that we've geocoded at residential addresses for all individuals in the data warehouse, so we know where everybody lives. We also know where they crash. So we have both geocoded addresses for the crash location and people's residence. And because we're able to find everybody's census tract, we were able to integrate community and systems level indicators. So there are many indicators that we want both on the community and individual level. And so we've integrated a number of these. I'll speak about a few, but those are all integrated to the NJ show. And the other thing that we have is race ethnicity for nearly all individuals in the NJ show. As you know, race and ethnicity are not collected on the New Jersey crash report or in the driver licensing files. So we undertook kind of an algorithm, which I'm happy to explain or lead you to if you're interested in kind of the methods. But we've basically been able to integrate race and ethnicity for every driver and every crash involved individual. And so because of this, we were able to really focus on a way that other data sets in the state don't, on focusing on a community safety approach and a transportation equity approach. And so this is complementary to many of you may know about Numetric, right? And so when transportation planners are thinking about where crashes occur, where to put new guardrails, where do we need, where are the highest risk intersections, you're really thinking about kind of an urban planning or a traffic engineering lens. And Numetric is a tool around New Jersey to help professionals really focus in on the danger zones and the high risk areas around the state. We really take a complementary approach. And when you think about where we implement educational or public health or safety interventions, we really want to do that in the places where the crash individuals live, right? So we're thinking about who do the crashes occur to and where do they live and where can we put campaigns and where do we put our educational efforts? And this is has been in our partner throughout our time making the NJ show warehouse. So this is really kind of what we're focused on, really thinking about where can we help, what is our niche in helping you inform your day-to-day work. And if you think about the importance of continuing to reassess the traffic safety landscape, right, as e-scooters and e-bikes are being more common, the landscape and autonomous vehicles, the landscape in New Jersey and other areas is constantly changing. So kind of keeping a finger on the pulse of the traffic safety landscape is super important. And then data comes in when you're really thinking about how do I locate the specific communities in need. This may be very different than the communities with the loudest voices, right? And so one of the things we really need to make sure is that we're implementing countermeasures where they are really needed. And this may differ for different issues and different traffic safety problems. And then it's really up to the professionals around the state and the planners and the safety community to allocate the resources and countermeasures in those communities that are found to be at highest risk. And then of course, data can come in on the back end to help evaluate the effectiveness of anything that is implemented within a community. So this is really kind of the iterative process that we're trying to help through our data. So here's an example. I was thinking, Keith asked me to share a specific example of where safety planners and transportation planners may use these data. And so if you think about the issue of child passenger safety, we had done an analysis between 2014 and 2017 that showed that almost 60,000 New Jersey drivers had at least one child less than 8 years old in their car when they were involved in a crash. And we looked at the percent of all those drivers who had all their child occupants restrained in a child restraint system. And we found that overall, only 3 out of every 4 drivers had all their child occupants restrained. So clearly there's a need to improve the CRS use among New Jersey drivers. But if we're limited in resources and where we can put our educational efforts and where we can put our fire station checkpoints, certainly we have to think about where the communities are that have the highest issue. And so one of the things we can do with our data is create something like this, which is every census tract in New Jersey, right? And we can actually look at the rate of CRS use among individual crash-involved individuals in each of these census tracts. And the kind of takeaway here is that and this is just a draft, so I don't want anybody looking at their census tract. We're actually coming up with, now we're improving this map. And so that's gonna be out soon. But basically what you can see from a high level is that there's a wide variety of CRS use across census tracts. So we're thinking about where do we put our fire station checkpoints and do those current checkpoints overlay, how do they overlay with this map? And so you can actually see if we're putting the checkpoints in the places that really need them across the state. Here's another quick examples that we can get with our data, which is really what you're seeing here is actually not just among crash involved individuals, but we have a methodology that we can look at on the trip level, the percent of all trips in New Jersey in which the driver was unbelted. And what you can see here is that that even though most drivers buckle up, that there's still a disparity in those that do between drivers who are living in New Jersey's most vulnerable communities, which is seen here, and those that are living in the least vulnerable communities. And even though, you know, this graph shows that 98% of all trips in New Jersey, in which the driver is belted, that really kind of equates to about, I can't remember, but I want to say it's tens of thousands of trips a year in New Jersey in which drivers are still driving unbelted. So again, this kind of shows us if we have seatbelt interventions, educational seatbelt checkpoints, what communities really can benefit from those interventions. So here's a look, kind of the feature of our NJ Show data is this data dashboard that you see here. And this is kind of our 1.0 version, but we're constantly thinking about how to improve the data dashboard. So if you see this, you know, you see this contact us over here, you're welcome to give us your thoughts once you start exploring the data. But basically the way that it is right now is there's 10 pages. You can see up here on the top, there's 10 different pages. There's a traffic safety overview. You can look at specific road users. This includes drivers, pedestrians, and bicyclists, driver behaviors, which include alcohol-related driving, driving unlicensed, driving unbelted, aggressive driving. And then we have other safety topics. So we have maps across the state. We look at young and older drivers. We have specific pages on pedestrians and bicyclists, and then a whole page dedicated to equity. And so you know, again, you feel free to explore this. The way that it kind of works, we're actually going to have some upcoming trainings on this in the next few months. So feel free to look out for those emails. But right here, briefly on this page, you can look at drivers or pedestrians or bicyclists, any county, and any kind of year between 2000. This page is 2009, the kind of current year, but these other pages go back to 2010. It focuses mostly on rates, and the reason why we do that is to normalize the county, right? Because if you don't do that, it looks like the biggest counties have the biggest problems because they have the most events, but they have the most events in part because they're the biggest counties. So you can see here, you can look at rates by sex, age group, and race ethnicity. We also do have all the ends behind these data, so you're welcome to contact us if you need more specific data. So here's a look at kind of the main page. There's also this one I just highlighted. This is alcohol-involved crashes in Atlantic County compared to the rest of the counties in New Jersey as a whole. And then we also have all crashes, injury crashes, and fatal crashes. We also have a lot of documentation on the site. So feel free to look at those PDFs, how we integrated the data, what each of the data sets includes, how we kind of collapse data across the different data sets. And I just wanted to shout out to our government partners. We've been working for the last 13 years with the New Jersey Division of Highway Traffic Safety, the Motor Vehicle Commission, the Department of Transportation, the Health Department, and then the New Jersey Office of Information Technology, who do a lot of our data draws and help us to obtain data from these other partners. We've also been funded by a number of different places over the 13 years, so I just wanted to highlight that. And then I'm happy to take any questions. Again, we would love for you to go onto the site, see how this can inform your work. One of the biggest things that we're trying to do over the next year or two is really also focus on, let's see how I get back to seeing you. Focus on, right now we started with county level, but our goal is to move down to the community level, the municipality level, so that we can show all of these numbers by neighborhood. And certainly some of the numbers will be too small to actually show in some aggregated form, but we're always willing to work with different organizations who are interested in kind of more of a deep dive. So you have the dashboard, but you also have access to us for collaborations in terms of being able to make reports, show aggregated numbers in any kind of form that you think will help inform your work.